What is calcium? Calcium is a chemical element with the symbol Ca and atomic number 20. It is an alkaline earth metal and one of the most abundant elements in the Earth's crust. Calcium is essential for many biological processes in the human body, including muscle contraction, nerve function, and bone formation. It is also important for blood clotting and the regulation of enzyme activity. Calcium is commonly found in dairy products such as milk and cheese, as well as in leafy green vegetables and fortified foods. It is often taken as a dietary supplement to support bone health and prevent osteoporosis. What are the health benefits of calcium? Calcium is an essential nutrient that is important for many biological processes in the human body. Here are some of the health benefits of calcium. 1. Strong bones. Calcium is a key nutrient for building strong bones and teeth. It is essential for bone development during childhood and adolescence, and for maintaining bone density and strength in adults. Adequate calcium intake can help prevent osteoporosis, a condition characterized by weak and brittle bones. 2. Muscle function. Calcium plays an important role in muscle contraction, including the beating of the heart. It helps regulate the movement of ions in and out of muscle cells, which is necessary for muscle contractions. 3. Nerve function. Calcium is also essential for nerve function. It helps transmit nerve impulses throughout the body and is involved in the release of neurotransmitters. They are chemical messengers that allow nerve cells to communicate with each other. 4. Blood clotting. Calcium is important for blood clotting. It helps activate enzymes involved in the clotting process, which is necessary to stop bleeding after an injury. 5. Lowering blood pressure. Some studies suggest that calcium may help lower blood pressure in people with hypertension, which is a major risk factor for heart disease. 6. Preventing certain cancers. Some research suggests that calcium may help reduce the risk of certain types of cancer, including colon cancer. 7. Weight management. Some studies suggest that calcium may help with weight management by reducing fat absorption and increasing the breakdown of fat in the body. Overall, getting enough calcium is important for maintaining good health. The recommended daily intake of calcium varies by age and sex, but generally ranges from 1,000 to 1,300 milligrams per day for adults. Good dietary sources of calcium include dairy products, leafy green vegetables, fortified foods, and calcium supplements. What if I do not consume enough calcium? If you do not consume enough calcium, it can lead to a number of health problems, including 1. Weak bones. Calcium is essential for building and maintaining strong bones. If you do not get enough calcium, your body may take calcium from your bones, which can weaken them over time. This can lead to an increased risk of fractures and osteoporosis. 2. Dental problems. Calcium is also important for dental health. A lack of calcium can lead to tooth decay and gum disease. 3. Muscle cramps. Calcium is essential for proper muscle function. Without enough calcium, you may experience muscle cramps and spasms. 4. Nerve problems. Calcium is also important for proper nerve function. A lack of calcium can lead to nerve problems, such as tingling sensations and numbness. 5. Blood clotting problems. Calcium is involved in the blood clotting process. Without enough calcium, you may experience problems with blood clotting, which can lead to excessive bleeding. To avoid these health problems, it is important to consume enough calcium on a regular basis. Good dietary sources of calcium include dairy products, leafy green vegetables, fortified foods, and calcium supplements. The recommended daily intake of calcium varies by age and sex. It generally ranges from 1,000 to 1,300 milligrams per day for adults. 6 health conditions and diseases in which calcium might play a role. Bone health in older adults, cancer, cardiovascular disease, CVD, preeclampsia, weight management, and metabolic syndrome. 1. Bone health in older adults. Calcium is essential for maintaining strong bones, and older adults are at increased risk for bone loss and osteoporosis. Adequate calcium intake, along with vitamin D and regular exercise, can help prevent bone loss and reduce the risk of fractures. 2. cancer, some studies have suggested that calcium may have a protective effect against certain types of cancer, such as colon cancer. However, the evidence is mixed and more research is needed to determine the role of calcium in cancer prevention. 3. Cardiovascular disease, CVD. Some studies have suggested that calcium supplements may increase the risk of cardiovascular disease, while others have found no association. It is unclear whether calcium itself plays a direct role in CVD risk, or whether other factors such as magnesium or vitamin D status may be involved. 4. Preeclampsia. Preeclampsia is a serious complication of pregnancy characterized by high blood pressure and damage to organs such as the kidneys and liver. Some studies have suggested that calcium supplements may reduce the risk of preeclampsia in pregnant women who are at high risk for the condition. 5. Weight management. Some studies have suggested that higher calcium intake may be associated with lower body weight and body fat, but the evidence is mixed. It is unclear whether calcium itself plays a direct role in weight management, or whether other factors such as protein intake or physical activity may be involved. 6. Metabolic syndrome. Metabolic syndrome is a cluster of conditions including high blood pressure, high blood sugar, and abdominal obesity, which can increase the risk of cardiovascular disease and type 2 diabetes. Some studies have suggested that calcium supplements may improve some components of metabolic syndrome, such as blood pressure and blood sugar levels, but more research is needed to determine the role of calcium in this condition. No substitute. It is important to note that while calcium may play a role in these health conditions and diseases, it is not a cure or a substitute for medical treatment. It is important to talk to your healthcare provider or a registered dietitian to determine if calcium supplementation is appropriate for your individual needs and health status. How much calcium should I consume? The amount of calcium you should consume depends on your age and sex. Here is the recommended daily intake of calcium according to the National Institutes of Health. Infants 0 to 6 months, 200 mg per day. Infants 7 to 12 months, 260 mg per day. Children 1 to 3 years, 700 mg per day. Children 4 to 8 years, 1000 mg per day. Children 9 to 13 years, 1300 mg per day. Adolescents 14 to 18 years, 1300 mg per day. Adults 19 to 50 years, 1000 mg per day. Adults 51 to 70 years, men, 1000 mg per day. Adults 51 to 70 years, women, 1200 mg per day. Adults 70 plus years, 1200 mg per day. Pregnant and breastfeeding women have higher calcium needs, and may need to consume more calcium than the recommended daily intake. It is important to note that excessive calcium intake can also be harmful, so it is important to stay within the recommended limits. Good dietary sources of calcium include dairy products such as milk, cheese, and yogurt, as well as leafy green vegetables, fortified foods, and calcium supplements. If you have concerns about your calcium intake, it is best to consult with a healthcare professional or a registered dietitian. What are the sources of dietary calcium? There are many sources of dietary calcium. Here are some examples. 1. Dairy products, milk, cheese, and yogurt are some of the best sources of calcium. For example, 1 cup of milk contains around 300 mg of calcium, while 1 cup of yogurt can provide up to 400 mg of calcium. 2. Leafy green vegetables, kale, collard greens, bok choy, and broccoli are good sources of calcium. For example, 1 cup of cooked kale contains around 180 mg of calcium. 3. Fortified foods. Some foods are fortified with calcium, such as certain brands of tofu, orange juice, and cereal. Check the nutrition label to see if a product is fortified with calcium. 4. Nuts and seeds, almonds, sesame seeds, and chia seeds are good sources of calcium. For example, 1 ounce of almonds contains around 80 mg of calcium. 5. Fish. Some types of fish, such as salmon and sardines, are good sources of calcium. For example, 1 can of sardines contains around 300 milligrams of calcium. 6. Legumes, beans, lentils, and chickpeas are good sources of calcium. For example, 1 cup of cooked black beans contains around 100 milligrams of calcium. 7. Calcium supplements. If you are not getting enough calcium from your diet, you may need to take a calcium supplement. Be sure to talk to your doctor before taking any supplements. It is important to consume a variety of foods that are rich in calcium to ensure that you are meeting your daily requirements. How can I get enough calcium if I am lactose intolerant? If you are lactose intolerant, you may have difficulty consuming dairy products, which are a good source of calcium. However, there are many other sources of calcium that you can incorporate into your diet. Here are some options. Non-dairy milk. Many types of milk, such as soy milk, almond milk, and rice milk, are fortified with calcium. 1 cup of fortified soy milk can provide up to 300 milligrams of calcium. It is important to consume a variety of foods that are rich in calcium to ensure that you are meeting your daily requirements. Should I take a calcium supplement? Whether or not you should take calcium supplement depends on your individual needs and dietary intake. It is best to speak with your healthcare provider or a registered dietitian to determine if a calcium supplement is right for you. In general, if you are not able to get enough calcium from your diet, or if you have a condition that affects calcium absorption, such as osteoporosis or inflammatory bowel disease, you may benefit from a calcium supplement. However, it is important to keep in mind that excessive calcium intake can also be harmful, and may increase the risk of kidney stones and other health issues. It is also important to note that calcium supplements should not be used as a replacement for a healthy diet. The best way to ensure that you are getting enough calcium is to consume a variety of calcium-rich foods, such as dairy products, leafy green vegetables, and fortified foods. If you do decide to take a calcium supplement, choose a high-quality product that is well absorbed, and follow the recommended dosage. Be sure to talk to your healthcare provider before starting any new supplements. Do calcium supplements have risks? Yes, calcium supplements can have risks if they are not used properly. Here are some potential risks associated with calcium supplements. 1. Constipation. Calcium supplements can cause constipation, particularly if you take too much calcium or do not drink enough water. 2. Kidney stones. Excessive calcium intake can increase the risk of kidney stones, particularly in people who are prone to this condition. 3. Interference with other medications. Calcium supplements can interfere with the absorption of other medications, such as certain antibiotics and thyroid medications. Be sure to talk to your healthcare provider before taking a calcium supplement if you are taking other medications. 4. Cardiovascular risk. Some studies suggest that high calcium intake, particularly from supplements, may increase the risk of cardiovascular disease. However, more research is needed in this area. 5. Hypercalcemia. Excessive calcium intake can cause hypercalcemia, which is a condition where there is too much calcium in the blood. This can cause symptoms such as nausea, vomiting, confusion, and fatigue. It is important to follow the recommended dosage and talk to your healthcare provider before taking any supplements, including calcium supplements. If you experience any side effects or have any concerns, be sure to speak with your healthcare provider. Types of calcium supplements. There are several different types of calcium supplements available, each with their own characteristics and benefits. Here are the most common types. 1. Calcium carbonate. This is the most common type of calcium supplement. It is inexpensive and has a high concentration of elemental calcium, around 40%. It is best taken with food because it requires stomach acid for absorption. 2. Calcium citrate. This type of calcium supplement is more easily absorbed than calcium carbonate, making it a good choice for people with low stomach acid or digestive issues. It contains a lower concentration of elemental calcium, around 21%, but can be taken on an empty stomach. 3. Calcium gluconate. This type of calcium supplement is less common and has a lower concentration of elemental calcium, around 9%. It is typically used in hospital settings to treat acute calcium deficiencies. 4. Calcium lactate. This type of calcium supplement is more easily absorbed than calcium carbonate, but has a lower concentration of elemental calcium, around 13%. It is often used in chewable tablets or as a liquid. 5. Coral calcium. This type of calcium supplement is made from the fossilized remains of coral and is marketed as a natural source of calcium. However, there is little evidence to support its effectiveness. 6. Hydroxyapatite. This type of calcium supplement is made from bone and is rich in both calcium and phosphorus. It may also contain other trace minerals such as magnesium and zinc. It is important to choose a high-quality calcium supplement that is well absorbed and contains the appropriate dose of elemental calcium for your needs. Be sure to talk to your healthcare provider or a registered dietitian to determine which type of calcium supplement is right for you. Factors to be considered while choosing calcium supplement. Choosing a calcium supplement can be overwhelming, as there are many factors to consider. Here are some key factors to keep in mind when choosing a calcium supplement. 1. Type of calcium. As mentioned in the previous answer, there are several types of calcium supplements, and each has its own benefits and drawbacks. Talk to your healthcare provider or a registered dietitian to determine which type of calcium supplement is right for you based on your individual needs and health status. 2. Dose of elemental calcium. The dose of elemental calcium is the amount of calcium that is available for absorption. Be sure to choose a supplement that contains the appropriate dose of elemental calcium for your needs. The recommended daily intake of calcium for adults is 1,000 to 1,200 mg per day, depending on age and gender. 3. Absorption. The absorption of calcium supplements can vary depending on the type of supplement and how it is taken. Calcium carbonate, for example, requires stomach acid for absorption, while calcium citrate is more easily absorbed and can be taken on an empty stomach. Choose a supplement that is well absorbed and consider taking it with food for best absorption. 4. Purity and quality. Look for a high-quality calcium supplement that is free from contaminants and has been third-party tested for purity and quality. The supplement should also meet the standards set by the United States Pharmacopoeia, USP, or other reputable organizations. 5. Other ingredients. Some calcium supplements may contain other ingredients, such as vitamin D or magnesium, which can enhance calcium absorption and provide additional health benefits. Be sure to choose a supplement that contains the appropriate amount of these ingredients for your needs. 6. Form and taste. Calcium supplements are available in a variety of forms, including tablets, chewable tablets, capsules, and powders. Choose a form that is easy for you to take and consider the taste if you have difficulty swallowing pills. It is important to talk to your healthcare provider or a registered dietitian before starting any new supplements, including calcium supplements, to determine the appropriate dosage and form for your needs. The groups that is most likely to need extra calcium. While most people can meet their calcium needs through a balanced diet, there are certain groups of people who may require extra calcium to maintain optimal health. Here are some groups that are most likely to need extra calcium. 1. Children and teenagers. Calcium is essential for bone growth and development, and children and teenagers require higher amounts of calcium than adults. The recommended daily intake of calcium for children and teenagers varies by age, with the highest needs during periods of rapid growth. 2. Women. Women are at higher risk for calcium deficiency due to factors such as pregnancy, lactation, and menopause. During pregnancy and lactation, women require extra calcium to support the growth and development of the baby and to maintain their own bone health. After menopause, women experience a decline in estrogen levels, which can lead to bone loss and an increased risk of osteoporosis. 3. Older adults. As we age, our bodies become less efficient at absorbing and utilizing calcium, and older adults are at increased risk for calcium deficiency and bone loss. The recommended daily intake of calcium for adults over 50 is 1,200 mg per day. 4. Vegans and vegetarians. Some plant-based foods are high in calcium, but vegans and vegetarians may have difficulty meeting their calcium needs through diet alone. Calcium-fortified foods and calcium supplements can help vegans and vegetarians meet their calcium needs. 5. People with lactose intolerance or milk allergy. Dairy products are a rich source of calcium, but people with lactose intolerance or milk allergy may have difficulty consuming enough dairy to meet their calcium needs. There are many non-dairy sources of calcium, such as fortified plant milks and leafy greens, but some people may also need to take a calcium supplement. 6. People with certain medical conditions, such as celiac disease, inflammatory bowel disease, and kidney disease, can affect the absorption and utilization of calcium. People with these conditions may require extra calcium to maintain optimal health. Calcium intake. It is important to talk to your healthcare provider or a registered dietitian to determine if you are at risk for calcium deficiency and if you require extra calcium supplementation. Calcium's interactions with medications. Calcium can interact with several medications, affecting their absorption, effectiveness, and safety. Here are some examples of how calcium interacts with different types of medications. 1. Antibiotics. Calcium can bind to antibiotics such as tetracyclines and fluoroquinolones, reducing their absorption and effectiveness. To avoid this interaction, antibiotics should be taken at least 2 hours before or after calcium supplements or calcium-rich foods. 2. Thyroid hormones. Calcium can reduce the absorption of thyroid hormone replacement medications such as levothyroxine, which can lead to decreased thyroid function. To avoid this interaction, thyroid hormone medications should be taken on an empty stomach, at least 30 minutes before eating or taking calcium supplements. 3. Bisphosphonates. Bisphosphonates are medications used to treat osteoporosis and other bone conditions. Calcium supplements can interfere with the absorption of bisphosphonates, reducing their effectiveness. To avoid this interaction, bisphosphonates should be taken on an empty stomach, at least 30 minutes before eating or taking calcium supplements. 4. Iron supplements. Calcium can interfere with the absorption of iron supplements, reducing their effectiveness. To avoid this interaction, iron supplements should be taken at least 2 hours before or after calcium supplements or calcium-rich foods. 5. Diuretics. Some types of diuretics can increase calcium excretion, leading to calcium deficiency. In these cases, calcium supplements may be recommended to help maintain adequate calcium levels. 6. Blood pressure medications. Some studies have suggested that calcium supplements may interfere with the effectiveness of certain blood pressure medications, such as calcium channel blockers. However, the evidence is mixed and more research is needed to determine the extent of this interaction. It is important to talk to your healthcare provider or a pharmacist about any medications you are taking and whether they may interact with calcium supplements or calcium-rich foods. In some cases, calcium supplementation may be recommended, while in other cases, alternative strategies may be necessary. To avoid interactions and ensure optimal medication effectiveness and safety,